Hello, everyone. My name is Mohamed Baraka. I'm Associate Professor of Clinical Pharmacy at Ain University in United Arab Emirates. Today, I'm happy to join you in celebrating the World Patient Safety Day 2022 with the World Health Organization under the slogan of Medication Without Harm. My talk will be about the role of pharmacists in patient safety through counseling and direct contact with patients. So I'm going to start with a little bit of background about medication safety, about the characteristics and the responsibilities of the medication safety leader, and then we'll conclude with some take-home messages. So let's start with a little bit of background about the medication safety. We all know that hospital and health system pharmacists have improved the pharmacy systems over the past 60 years to reduce the risk of medications. And medication safety was at the heart of such innovations in pharmacy services provided as unit dose systems, decentralized clinical pharmacy services, and preparation of intravenous mixtures. Pharmacists actually can play a major role in reducing patient safety risks and optimizing the safe function of the medication management systems, in addition to aligning pharmacy services with the national initiatives. Traditionally, the medication safety leader role has been done by a clinical pharmacist, but sometimes it can be filled by a nurse or physician. The medication safety leader should be positioned on the organizational chart, and this position should remain targeted on the medication safety. Now, let's have a look on the overview of the characteristics of a medication safety leader. In order to be a medication safety leader, you need to have a strong understanding of the internal systems and the processes of the organizations in which you are working. You should also have enough clinical expertise and a broad understanding of the healthcare systems and to be able to interpret the clinical events. You should also have enough knowledge and experience about the medication use systems, including procurement, prescribing, transcribing, preparation, distribution, administration of drugs, in addition to documentation and the monitoring. You should also have some strong analytical skills. You should be able to understand the statistics and the data that can be generated from analyzing the events. You should have enough knowledge of performance improvement methodology, such as root cause analysis and the methods used for monitoring projects and measuring the progress of the performance. In addition to having a specialized training in medication safety, such as residency and fellowship programs. A set of skills should also be there for safety leaders or medication safety leaders, like leadership skills, presentation and communication skills, writing and editing skills, to be able to communicate errors and to communicate the reporting process to others. You should also have a strong personal belief that resolving problems should be a system-wide process, not only an individual one. In addition to being a proactive person and being able to spread the just culture and the transparency, in addition to understanding the concepts and application of safety principles and continuous quality improvement. The medication safety leader should be a person who is having appropriate assertiveness, should be a person who is enjoying a passion for medication safety, should be able to communicate with and work with interdisciplinary teams in order to report the medication errors and improve the awareness regarding medication safety in general. You should also be able to engage patients in this process with the healthcare team and to be eager to learn and to do high quality research. So at the end of the day, you as a safety leader, you will work like a computer analyst and a statistician, a detective and risk manager, a counselor for healthcare providers and for your patients, an engineer and accountant, an educator, preceptor, and mentor for junior colleagues and the compliance officers too. Your typical day may include the following tasks as a safety leader. You should attend safety rounds and precept and train pharmacy students and residents. You may write policies and review adverse drug events and medication error reports. You may also develop error prevention strategies and lead the process of implementation in order to improve this practice. You may implement actions, items, and review smart pump libraries. You should ensure use of automated medication dispensing systems. You should assess the safety of replacement drug products during drug shortage, orienting the new professional staff and designing and optimizing the medication reconciliation process. You may conduct tracers to ensure compliance with the accreditation standards like the GCI ones. You should work with practitioners to resolve acute events and attend the medical staff meetings and educating staffs and leaders. The responsibilities of the medication safety leader should be as follows. Your safety leader role should be like responsibility for leadership. You should enjoy medication safety expertise and be able to change the practice using research and education. When we talk about the leadership role, you as a medication safety leader will develop a vision of an individual safe medication use system for the organization and supervise the planning and implementation of the medication safety plan. You should work proactively to develop and lead the implementation of the strategies to prevent errors using high quality standards and making sure you are following the guidelines. You should also ensure medication management and patient safety are the core component of the overall organization quality and outcomes initiative. Still talking about the leadership, you should also participate in the planning, design, and implementation of the organization medication use technology and automation systems. Being able to build and spread the culture of safety and learning lessons, educating others, and communication, improving communication across the entire organization. Your role as a leader is to oversee and supervise processes, to collect information, and to capture the medication errors, and to make sure the barriers to reporting are addressed to improve the identification and reporting of adverse drug reactions. You should ensure compliance with the legal requirements related to medication safety and support the development and implementation of a second victim program. When we talk about medication safety expertise, we all know that pharmacists are having enough expertise regarding medication use and regarding the medication safety. And for that reason, they will serve as an authoritative resource on medication safety for the whole organization. They should contribute the medication safety perspective for technology initiative and for emergency preparedness planning. Having this expertise, they should also serve as an internal consultant to investigate the medication safety events, making sure they can make sense of the data generated from such analysis. They should serve as the chair of the medication safety committee and work collaboratively with others to improve the medication safety. In order to do this, they should have enough knowledge in the application and use of the quality improvement methodologies. They should collect, review, and analyze the organization's medication use process in order to improve on, and in order to have enough data for quality improvement. Using this expertise, they can also predict and prepare to manage medication safety issues caused by drug product shortage and the use of replacement of drug products. In addition to this, they should maintain knowledge of trends and developments through having continuous professional development, and this can be done through attending seminars, conferences, educational programs, and making sure they are receiving updates all the time. They should participate at local and national levels in patient safety and medication safety initiatives. In order to change the practice and influence the practice, pharmacy leaders or medication safety leaders, they will collaborate with other departments to identify and prioritize the safety issues, making sure to have strategies to reduce the risk of inappropriate medication use. They should manage changes in the medication use systems and address and resolve the medication safety issues, and being able to integrate the medication safety into the overall strategic plan of the organization. They also participate in or lead multidisciplinary committees in the hospital in order to identify the risks and prioritize the system improvement. In addition to consulting and advising specific clinical teams in the hospital and encouraging organization-wide medication error reporting through established systems for this. Pharmacists also, or medication safety leaders, in order to change the practice, they should develop effective methods for spreading best practices for medication use and use continuous quality improvement principles, review and update the clinical decision support tools to make sure identification and reporting can be done at the right pace and time. We cannot do this actually without high quality educational programs and conducting high quality research to improve the medication safety. And for this, you as a medication safety leader, you need to design and assist in the implementation of educational and high quality orientation programs for the other staff. You should also develop a competency assessment tool or program for other staffs and other healthcare providers. You need to share information about the medication errors with the safety organizations like the FDA, Midwatch program, and the other error reporting programs. You should conduct medication use safety research using high quality externally validated studies. You should contribute to the literature on medication safety and provide education to other pharmacy colleagues and junior healthcare providers. In addition to integrating medication safety into the orientation and the training programs for the other healthcare providers. The process of comprehensive adverse drug reaction monitoring and reporting should include the following steps. Number one, adverse drug reaction reporting. And after reporting of adverse drug reactions, the interdisciplinary team should evaluate the metrics of this adverse drug reaction monitoring. And they should discuss the analysis, they should discuss the results of such analysis with the appropriate groups of healthcare providers. Based on this, they should develop a plan to reduce the risk and mitigate and monitor future adverse drug reactions. These plans should be implemented and should be educated, and education should be done for other healthcare providers, other physicians, pharmacists, nurses, and others. Ongoing surveillance and continuous improvement to make sense of these results should be done, and reporting to external organizations should be done as required, either locally, nationally, or international. To conclude our talk today, the American Society of Health System Pharmacists thinks that medication safety is a fundamental responsibility of all members of the pharmacy team. And for medication safety programs to succeed, three major things should be there: a vision and direction, identification of opportunities to improve the medication use systems, and leading the implementation of error preventing strategies. Your role as a medication safety leader includes responsibility for leadership, medication safety expertise, having high quality educational programs, conducting high quality research to influence practice change. And the American Society of Health System Pharmacists believes that because of the training and the knowledge and the skills pharmacists have, they are uniquely qualified to take the responsibility as a medication safety leader. At the end of the day, you as a pharmacist, you are in the core of the medication safety process, and you are the ones that should carry the responsibility with other healthcare providers, and you should have enough knowledge and the skills to perform that task. So finally, thanks so much for your attendance and attention, and I leave you to enjoy the celebration. Thanks so much, and see you in other events.